In this video, we're going to talk about the hand. When you fall on an outstretched hand, the most common fracture you're going to get is a scaphoid fracture, and that occurs here in the anatomical snuff box. This area doesn't have great blood supply, so you're at risk for avascular necrosis or non-union formation. It's very important to immobilize the hand and put it in a thumb spica cast. If you were to take an x-ray right after the fall, it'll most likely be negative and you won't really see anything on it for about a week to 2 weeks, but an MRI is pretty sensitive. So the treatment course for this is usually to stabilize and immobilize the hand and get an x-ray a week to 2 weeks later. Another type of fracture that can occur with the fall on an outstretched hand is a Colles fracture, and this is fracture of the distal radius. On x-ray, this will look like a dinner fork deformity, and if the angulation is more than 15 to 20 degrees, you should consult surgery. Otherwise, casting the arm should be fine. And anytime you have osteoporosis, you're at increased risk for fractures. There's a bone in the wrist called the lunate bone, and if this is fractured, you can get median nerve symptoms since the median nerve runs across that. And there's another bone in the wrist called the hamate bone, and the ulnar nerve runs through the hook of hamate, so if that's damaged, you can get ulnar nerve symptoms. If you were to punch a wall or punch a person with a closed fist, that's called a boxer's fracture, and that'll be a fracture of the 4th and 5th metatarsals. If you fall on a flexed wrist, that's called a Smith's fracture. Anytime you have like a puncture or like a cutting injury to your hand, the most likely thing you're going to damage are tendons, because just of the way that things are layered in the hand, you have like the fascia, muscles, and underneath all of that, then you have the arteries, nerves, and veins. Next, we have radial head subluxation, and this occurs when the radial head pops out of the annular ligament. This is very common in kids when, let's say, they're trying to run away and you grab their hand really fast and pull them towards you, or if you're swinging their child by their arms, that's also an easy way for the bone to pop out of the ligament. To fix this, you could either pronate the arm or you could supinate and flex the elbow. Next, we have a supracondylar fracture, and this will occur at the elbow, and this happens when you fall on an outstretched arm. To diagnose this, you can take an x-ray. Usually, a posterior fat pad won't be visible, but it is when this occurs. Also, you can see displacement of the bones. If the bones are displaced, then you would need a contact surgery. If they're not displaced, you can simply put them in a long arm splint. There are two important complications of a supracondylar fracture. First is compartment syndrome, and another is neurovascular injury because the brachial artery and the median nerve run through the elbow. Dupuytren contracture is progressive fibrosis of the palmar fascia. So usually patients will present with certain fingers being flexed, and it'll be really hard to extend them because of the extension of fibrosis. And to treat this, you can do intralesional steroids, or usually this will also happen when they have repetitive movements of their hands, especially if their jobs entail working with their hands a lot. So you can give them fitted or padded gloves or change the tools that they're working with to help them out in that way. Risk factors for this just include increased age, usually people above the age of 50. It's more common in men. And also if you have diabetes, that's another risk factor. There is some sort of family inheritance, but the genetic pattern isn't clear. Lastly, we have a ganglion cyst. This usually occurs on the wrist, usually on the ulnar side, but it can occur anywhere on the wrist. Usually bikers will get this too, since their wrists will be in this position for a long time. It's basically a mucinous filled area that'll transilluminate and resolve spontaneously, but you can do an ultrasound and MRI if you want to confirm the diagnosis.